Hello, I'm Benchimol, and I'm a pediatric gastroenterologist at the CHEO Inflammatory Bowel Disease Center, a senior scientist at the CHEO Research Institute, and a core scientist at ICES. Inflammatory bowel disease, or IBD, is comprised of two subtypes, Crohn's disease and ulcerative colitis. These are chronic gastrointestinal disorders in which there's ulceration and inflammation of the GI tract. There is no cure for these diseases. We know that people with IBD are at increased risk for mental illness such as anxiety and depression, and this is potentially due to the inflammation affecting their brains. In this study, we used Ontario healthcare data from 2002 to 2017 in order to assess whether pregnant women with IBD were at increased risk for new onset mental illness compared to other pregnant women in the province. We assessed the risk of new onset mental illness in pregnant women with IBD during pregnancy and up to a year postpartum. We found that pregnant women with IBD were at elevated risk of new onset mental illness. These rates were about 22.7% of pregnant women with IBD compared to 20.4% of pregnant women without IBD. That translates to about one extra case of mental illness for every 43 pregnancies in women with IBD. Pregnant women with IBD were at increased risk for mood-related disorders like anxiety and depression, as well as substance-related disorders like opioid dependency. This risk was elevated in the postpartum period but not during pregnancy, and was elevated in patients with Crohn's disease but not ulcerative colitis. We hope that these findings will make patients with IBD as well as healthcare providers aware of the risk of mental illness in the postpartum period. This will provide opportunities to prevent mental illness as well as to identify and treat it earlier.